Are you curious about your sexuality? Are you also conscious enough how your physical self looks like? Are you bothered about how people will say about how you look like? If the answer is yes, this topic is for you. Anyway, I am teacher Ryan Jimenez. If you're new here in my channel, don't forget to click and subscribe and hit the notification down below to be updated of my upcoming videos. This session, we will talk about sexual and physical self. We will unpack or reveal into details about the views of our sexuality and our physical self. So let's first identify what is our purpose by looking at our lesson objectives. At the end of this lesson, you'll be able to define what physical self is, discuss the different views of one's physical self, determine the factors that influence the change of view of one's physical self, discuss the developmental or development aspect of the reproductive system, describe the sensitivity of our self, our body, or what we call the heterogeneous zones, explain human sexual behaviors, and we have characterized the diversity of sexual behaviors, describe sexually transmitted diseases, and differentiate natural and artificial methods of contraception. And I'll be injecting some program that can help you improve or achieve or attain healthy sexuality. Now let's begin. As humans as we are, there will be a point that we tend to become conscious of how we look like, conscious on how people may say about us, how this culture nowadays injects that kind of image of beauty and what is not beautiful. And there are also people who are already contented on how they look like. Others would actually go improving themselves by making themselves beautiful, sexier, muscled, macho, and some other things in order for them to be accepted. On the other hand, that kind of physical self that we keep on pursuing can either build or destroy our relationships because of our transformation of one's physical characteristics. Some people are willing to exert much effort and spend a lot of money just to improve how they look like. There's nothing wrong about it as long as it won't harm other people and that makes you happy, go for it. However, you have to maintain the foundation of establishing social harmony with other people. And whether we like it or not, beauty is sometimes correlated or associated to physical attractiveness. If you look like, if you tend to look at Koreans and some other foreigners that are good looking in our eyes, we see them as models of beauty. But if you tend to deepen that kind of perspectives of what beauty is, you get to understand that this is more than how we see by our eyes, more than how we experience by our hearts. To appreciate our sexuality, our physical self, is to understand the concept of sexual self. Let's proceed. Before we will discuss about this, let's have an activity. I want you to pause for a while this video and allow me, allow yourself to explore your own opinion, your observation on the following list. So I have there 1 to 6. Try to read them and answer them separately, and your teacher will check them, give their opinions about your answers. Don't you worry, there is no wrong and right answer here. According to Jeremiah 1:5, before I formed you in the womb, I knew you, and before you were born, I consecrated you. I have appointed you a prophet to the nations. How you look like is already predetermined. God. God already predetermined how your physical formation looks like. And no one could actually deny, complain, feel dissatisfied how you look like because you are the very creation of God. And if you reject that, it is as if you are already rejecting God's plan for you. So be thankful, be gratitude, have that kind of sense of gratitude that you are a son or a daughter of God. So before you were formed in your mother's womb, God has already saw your purpose, why you are here on earth. In the scientific perspective, your sexuality determines by genetics. It is the combination of your influence by your biological mother and father or their descendants. So your sex is determined by the combination of the chromosomes. We have the XX for female and XY chromosomes for male. So if you are a female, because of your mother's sex chromosomes, XX, and if you are the male, you are actually getting from your father's chromosomes the XY. However, there are individuals who are not happy to how their physical appearance is. Some will actually undergo a sex change. Others, because of their abnormalities of their sexual organs, they will undergo surgery. Aside from our genes, our society is one of the factors that will transform our sexual behavior. And this helps us understand on the development of sexual characteristics and behavior. Let's look at how the reproductive system develops. So we'll be talking about the sex organs of male and female. But don't you worry, we will not go into details what the parts are of male and female, but how these sexes determine, contribute to the sexuality that you have right now. I will let you meet a friend of mine. This is what we call gonads. So gonads are terms used to describe the reproductive systems of both male and female. So the gonad of male and the gonad of female. So gonad is the organ that makes the gametes. The gonads in males are what we call the testes, and the gonads in females are the ovaries. So the product, the gametes, are what we call the haploid germ cells. So if we have bacteria, germs, we have also this so-called as germ cells. The germ cells are actually haploid that are the product of the gametes. For example, the spermatozoon and egg cells are gametes. Though the spermatozoon of your father and the egg cells of your mother are actually gametes in the what we call gonad. Now, according to Marie E.N. 2001, that your sex, your being male and female, is actually based on the time of fertilization, where The sperm cell of your father will actually go to the fallopian tube of your mother, and the egg cell will actually meet the sperm cell, and they will actually fertilize. And the moment they fertilize, that will form is what they call the zygote. So once the zygote is already formed throughout time, like weeks or months, that becomes what we call the embryo. So the embryo is now the initial stage where the baby becomes humans. So from embryo then turns to be fetus, and fetus to become fully developed human. It's what we call the babies. Now, the males have X and Y chromosomes and female XX. So the gonads do not begin to form until about the 8th week of embryonic development. So do not begin at, it should be like 8 to 9 week that will determine the sex of the embryo or the fetus. The embryonic reproductive structures of male and female. So basically the the sex organs of the embryo will actually uh, they will actually have the same formation. And don't you know that even male or female as embryo before 8th week, all of us came from being female, having that kind of female organ. So it is just flat. And there's what we call the development of the accessory structures and external genitalia begins. So in the presence of the testosterone, so the formation of the sex of the embryo will sprout out, elongate to become male genitalia. And the absence of the testosterone will actually determine the female sex of the baby. When the testosterone is not produced, as what I said, is in the case of female embryos that will form ovaries, the female ducts, the veins, the genitalia result. However, there's abnormality, the interference with the normal pattern of sex hormone production in the embryo results in abnormalities. And these abnormalities called to be a pseudohermaphrodites. In other words, the embryo will have two sexes, can either be having both testes and even the female organ, the genitalia. So here, there is a tendency if the, the embryonic testes fail to produce the testosterone, so the genetic male develops the female accessory structures and external genitalia. However, if the genetic female of the embryo is exposed to the testosterone, the embryo has ovaries but develops male accessories ducts and glands. So basically, the embryo will have two sex organs. And that's what we call the hermaphrodites. The other one is what we call pseudo hermaphrodites. In other words, there is no sure yet. No, so having that kind of two sexes. But if it is developed as childhood, as part of childhood becomes adult, and there's already part of that, if it is not rectified or corrected, so that will be brought until adulthood. So others will actually sought that kind of sex change operation to match their outer selves as male and then the opposite having a sex organ of a female. So they actually undergo sex change operation. And there's a term what we call the cryptorchidism. The cryptorchidism is the failure of the testes to make normal descent that leads to condition. So basically, this is a kind of disease, no abnormality that the male cannot produce a normal semen. So this condition results in sterility or what we call pagkabaog of a male and also puts him at the risk of having that kind of cancer of the testes. So what we need, what the person needs now is surgery and should be done or performed during childhood to correct this kind of problem. And if there is what we call abnormality separation of the chromosomes, like in the meiosis is basically the split of cells, can lead to congenital defects of the reproductive system. For instance, males who have extra female sex chromosome, remember XXY, having an extra female chromosome, the tendency is the normal male accessory, the organ of the male having a penis, but their testes atrophy, causing them to sterile. So in other words, there is a abnormality on the chromosomes or the formation of the accessory of male that will lead to sterility. So when a child has only one chromosome, the, the X0 female appears normal but lack ovaries. Okay, remember the XX for female and XY for male. So if the chromosome of female lacks one X chromosome, so basically the baby would lack ovaries. So the Y and 0 O male die during development. There's a term what we call the phimosis. The reason why males will undergo circumcision, not just a personal hygienic purposes. However, there's also what we call to avoid this kind of disease or abnormality, what we call the phimosis. So the phimosis, which is essentially is narrowing of the foreskin, so the extra flesh of the male reproductive organ and misplaced urethral opening. So the extra skin of male on the forehead, if it is not circumcised, so the tendency the skin will actually attach and will develop another skin, and it will be hard for male to urinate. So that is why the extra flesh that is near to the head of the penis is actually removed so that the urination will actually have a, a good way of urinating. Okay, now as you go in the development as human, all of us will actually undergo puberty. So the puberty is the period of life, generally between the ages of 10 to 15 years old. So what will happen then here during puberty? So the reproductive organs grow to their adult size and become functional under the influence of rising the levels of gonadal hormones. So from the word gonads, no? So gonadal hormones. So the hormones of male is what we call testosterone, testosterone, and estrogen in females. So it is important to note that puberty represents the earliest period of reproductive system in activity. For male, no, there's a signal of what they call the enlargement of the testes in the scrotum. The scrotum is the balls, no, underneath the penis around the age of 13 years old, and then the appearance of pubic, axillary, the mustache, the beard, the extra hair on the armpits, the facial hair. So these are the manifestation of male puberty. The young man has an unexpected and sometimes embarrassing moment, the erection, especially on the nocturnal emissions, know what we call wet dreams. So the tendency that the male during puberty time will actually will experience what we call emission of semens while he was sleeping. No, this is because of the hormone surge and hormonal controls struggle. So there's a struggle of a young boy during this time to maintain a normal balance. On the other hand, female will have this what they call the puberty of the budding of the breast, mamukol na, at the age of 11. So the first menstrual period is what we call the menarche. So this occurs 2 years later. So 2 years later, like 11, 12, 13. So female will actually experience bleeding. So what they call menstruation. Okay, next we have this kind of diseases that when women and men experience on their reproductive organs. So this is what they call, we have the E. coli, no? We have the Escherichia coli, no? This is E. coli. These are the bacteria that we get from our lifestyle, our eating, genetic, that will actually affect our reproductive organs. So others will actually have this kind of infection. So if this kind of infections that will persist, so it will be better that you will consult your doctor. And we have here, if you have multiple sex partners, so basically there will be a tendency that you will experience or acquire that kind of sexually transmitted microorganism like gonorrhea, syphilis, and herpes virus. So basically, some of these viruses do not have yet vaccine. So we have to be careful of who those people that we are mating. All right. So untreated infections spread throughout the male reproductive tract, causing pelvic inflammatory diseases and even sterility. Problems involving painful or abnormal menses may result from infection or hormonal balance. So we really have to be careful enough of the kind of sexual behaviors that we have towards other people. Otherwise, we will experience this kind of diseases. And for most common inflammatory conditions in males, what they call the urethritis, the glycogen ihi. So basically, the male can have a hard time in urinating, the prostatitis, epidermitis. So basically, these are diseases that we get from sexual contacts. So what they call the STD, the sexually transmitted disease microorganisms are transmitted. And there's another term, what they call the orchiditis, or the inflammation of the testes, that are uncommon but serious because it can cause sterility. So you cannot produce semen, healthy semen. So basically, you cannot produce or contribute fertility for female. All right, next is what we call the heterogeneous zones. So the heterogeneous zones, these are the parts of our body that are chiefly sensitive and can cause increased sexual arousal when touched in sexual manner. So this is widely known as the EZ. So our sensitive parts are our mouth, our breast, our nipple, our areola. Areola is especially the surrounding skin of our nipple, the reproductive organs, and even our anus. So these are parts that can arouse sexual arousal. So the erogenous zones differ from person to person depending on which part of his or her bodies that are sensitive. So gilkanon tayo, we don't want others will actually touch our neck because it will tickle us, no? Others will actually feel that kind of tickling on their neck, on their thigh, their abdomen, and feet. All right, so the level of erotic sensitivity of a particular body is dependent on the amount of nerve endings, depending on the nerve endings that are located in the region, such as the genital regions of the male and female body that undergo what we call the process known as the vasocongestion. So the vasocongestion is the amount of nerve endings that are located in our regions, the amount of nerve endings. So the more nerve ending on that particular region, that the more sensitive, though the erotic sensitivity becomes. So the erotic sensitivity is dependent on which part of our body that have a great amount of nerve endings. So the greater amount of nerve endings in the located region of our body, especially in our genital regions. So it is what we call the process of vasocongestion, which increases the amount of blood flow to these regions. So basically, when we are touched, especially in the genital region, so this becomes highly sensitive and can be cause arousal. This is according to the University of California 2017. Other areas such as the eyelids, the forearms, the head, and even our abdomen have fewer nerve endings, but can also be potential for the erogenous zones for some, especially if it is touched lightly or softly during foreplay. So these erogenous areas consist of exploring each other's body simultaneously during sexual activities, no intimacy in a relationship. All right, moving on to the next subtopics, what we call the human sexual behavior. And this is one of the things that we need to understand for us not to be ignorant about it. There are two types of human sexual behavior. So basically, when you talk about human sexual behavior, it is any activity, private or not, solitary between two persons or in a group that induces sexual arousal. That's according to Gebhard 2017. There are two factors why that determine human sexual behavior. One, it is inherited. Number two, it is the degree of the restraint or the types of influence. Basically, inherited or influence. All right? The types of behavior, namely, we have solitary sexual behavior, we have the sociosexual behavior. Let's begin with the solitary behavior. So the solitary behavior is known to be what we call the self gratification. The self gratification is a self simulation with the intention of causing sexual arousal and generally sexual climax. Most of the self gratification is done in private, so this is what we call the usual term we use here is masturbation, but is sometimes practiced if it is guided by social-sexual relationship. In general, beginning at the before puberty is very common among young males. So basically, during this time, the young male and even young females will actually have that kind of curiosity that actually lead them to experience this. But the moment they will have partners, social sexual activity, they have the tendency to abandon it because of the availability of the social sexual activity. In the United States, in the solitary behavior perspective, half to two-thirds have among fewer females practice self-gratification so as compared to 9 out of 10 males. So basically, it is really the males will who have the tendency to experience masturbation or what we call the social sexual solitary behavior. There's also a great individual variation, no? Depending on the situation, the frequency, so it is impractical to try to understand what is normal and not normal in self-gratification. So there's a myth that perceives that self-gratification is actually immature behavior. However, it is not an immature behavior because there is what we call psychological significance of self-gratification. Others, they will just lay it down, no, lay with guilt. Some will actually release tension with no emotional content. They will just masturbate and do nothing feel about it because they just want to release the tension. And others will simply a source of pleasure, just want to experience this to be enjoyed for its own sake. Alright, most of the sexual solitary behavior, majority of the males and females have fantasies while they are doing sexual activity alone, while they are practicing self-gratification. So this person, you have the control to manipulate, maneuver your body to the amount of pressure, the rapidity of the movement that you are in control about it. No? Because the more rapid the rapid movement that you have with your body, the more pleasurable it becomes. So the self-gratification is often more effective in producing sex arousal and sexual climax than social sexual activity because you are in control about it, wherein the stimulation is determined by some degree by one's partner. However, there's what we call sexual climax during sleep, and usually have the what they call the emission, the semen emission during this time. And in average, uh, in 1 year, male will actually experience wet dreams 12 times a year. But for female, it is just 3 to 4 times a year in average. We, we cannot deny the fact that no matter how we try to avoid, we are actually sexually attracted, and that will stimulate sexual arousal. The way how we look, how sexy or how mature the person is, that will have the tendency that we experience that kind of attraction because of the sexual stimuli when seeing attractive persons. On the other hand, another stimuli that will actually cause sexual arousal by the use of advertising and mass media, the sexual themes like pornography. We have the adult entertainment, no, in response to such visual and other stimuli, is actually strongest among men or even female adult and even early adult life. And they have once they have partner, so that kind of sexual desire towards watching porn will actually decrease when advancing in age. The question is, how do you cope with sexual desire and achieve some balance? So what will happen if you suppress this desire? So this will be the questions that allow you to think over if the kind of sexual desire becomes excessive, and what will happen if you will suppress or deprive the kind of sexual desire. I have a program that I will suggest to you. This is what they call the NoFap benefits. So, are you familiar with NoFap? Okay, if it is your first time, let me first define what is NoFap. The term NoFap, now a trademark name and business, came from the word fap, which is the internet lingo for sound of jerking off. So the NoFap promotes quitting not just masturbation, but also porn and other sexual behaviors. So what are the benefits or potential benefits? According to PubMed Central, the PubMed Central is a reputable and known medical research towards it. Now, they found out that if you will not ejaculate for 7 days, the testosterone level of your body will actually increase. So, the increase of muscle mass, the body figure will actually achieve physique, no? And the mass helps control weight and increases energy. So, by 45.7 or 46%. So if you're that person right now having a struggle, this kind of sexual behavior, and then you see that your body does not have any improvement, no matter how you try to exercise, but of course with the help of diet, then your muscle is not growing and you're still lean, you're still thin, and even you're still fat because perhaps there will be possibility that you have an excessive that kind of sexual behavior. So NoFap is one program that will help you, that will promote quitting, no, to really improve the kind of self-image. Number one, what they call the mental benefits. So basically, after 21-day challenge, you'll increase happiness, you will boost your confidence, you will have a kind of motivation and willpower. And one indication that you will observe if you don't do the NoFap is you are easily discouraged, especially you can easily feel depressed because you know what, when you do fapping, so basically you will get tired. And the moment you get tired, you don't want to do anything, you just want to relax yourself. But to the point, you don't know exactly, and because you don't know what to do exactly, you will think negatively and even things that will not help yourself. So through this NoFap program, will actually heighten your spirituality. You have what you call the self-acceptance, attitude, and appreciation towards the opposite sex. Another is what we call the physical benefits. No, the higher the energy levels that you will have, There will be a muscle growth, better sleep, improved focus. You will have concentration in NoFap. So better physical performance and stamina. It will improve your cured erectile dysfunction and improve sperm quality. However, there will be a point that there's also a benefit of doing fapping or jerking off or masturbation. Of course, others, why do they do that? Because that will improve their mood, they will actually have better sleep, stress and tensions relief from menstrual cramps, low risk of prostate cancer. But actually, the NoFap will actually, this is just a way of shifting your the mindset of doing things right. So people believe it offers many of the same spiritual, mental, and physical benefits as NoFap. All right, so that will be a chance that you will give to yourself doing NoFap challenge. And tell me on the comment section the result of having NoFap. I will be glad to hear that from you. All right, next we have the sociosexual behavior. By far, the greatest amount of sociosexual behavior happens between male and female. It is what we call the heterosexual. Frequently begins in childhood, no? And while much of it may be motivated by curiosity. So basically, no, this happens during childhood. We want to explore how it feels like and so on. So basically, some of the children will actually examine their genitalia, touch it, feel the pleasure, and of course, as parents, we really have to guide your children of doing such things. Okay, with adults, no, they actually have the sex play that be superseded by dating. So basically, when you do dating, there will be, and it's inevitably experience. No, you will be involving some physical contacts, touching each other, that will cause sexual arousal. This contact labeled necking or petting is a part of learning process. So you're kissing, hugging each other. Until such time, this will be a selection of marriage partner. So petting varies from hugging, kissing, generalized caresses of the cloth body to techniques involving genital stimulation. There's what we call the term the coitus, no, the insertion of the male reproductive organ into the female reproductive organ. Is viewed by society quite differently depending upon the marital status of the individuals, or what we call the sex. The majority of the human societies permit premarital coitus. So ang premarital coitus is especially among teenagers or singles, that they do sex out of marriage. So that's what they call premarital sex. And there's what they call also the marital coitus, so sex between married couples. There's what they call the extramarital coitus, so having sex outside marriage. So when you do infidelity for both men and female, so basically that's what they call extramarital coitus. But in other perspective, in the extramarital coitus, there are some other cultures that allow having more than two husbands or even wives in the marriage. So having more husbands and wives as as a family. So having multiple partners in the family, that's what we call extramarital coitus. And the other one is what we call the post-marital coitus. So they are divorced, but they still do sex. And basically, the society that we have here, we do not suggest premarital sex because your sex is by religion is sacred, and that is intended for godly pursuit, or what we call sexual purity. And this is actually a data way back 2013. These are the countries that showed how unacceptable premarital sex is. The top five countries that do not support premarital sex is what they call, these are the Indonesia, Pakistan, Egypt, Nigeria, and the Philippines. And the seemingly not supporting at all, but they still look at it as unacceptable. We have the France, Germany, Spain, Japan, Korea, and so on, the United States. Okay, but this data can change over time. In other words, this only shows to us that these countries still preserve that kind of perspectives, that should be this, the sex should be done within marriage. Okay, now I will show you some statistics about infidelity. Who are prone in cheating? Is it really the male or the female? So let's look at the some percentage. We have here that 22% of married men have strayed at least once during their married lives, and 14% of married women haven't had affairs at least once during their married lives. If we will compare, it is the male who have the tendency to go astray having sex with other partner, and in comparison with 14%. And if you can see also here that 70% of married women and 44% of married men do not know that their spouses having an extramarital activity. Again, it is more on the married men. Next, 5% of married men and 3% of married women reported having sex with someone other than their spouse in the year of 1997. And 22% of men and 14% of women admitted to having sexual relations outside their marriage sometime in their past. So see, and 90% of the Americans believe that adultery outside marriage is morally wrong. 61% of the Americans thought that adultery should not be a crime, and 35% thought it should be, and 4% had no opinion. So see, though if you look at the previous slide, 90% they believe adultery is morally wrong, but not a crime. So that's quite ironic. And 17% of the divorces in the Philippines, I mean in the United States, are caused by infidelity. There's a recent study revealed that 45 to 55 of married women and 50 to 60 married men engage in extramarital sex. So see, 40, it's really the married men have the tendency to engage in extramarital sex. And only 46% of men believe that online affairs are adultery. 80% thinks it's okay to talk to with stranger identify as opposite sex. 75 think it's okay to visit an all adult site. And 50% of people have used the internet to flirt. So there is another way to commit infidelity through online. And 38% of people have engaged in explicit online conversation. And 50% from online conversation, they will actually phone each other, chat each other, and meet each other. 50%. And there's the evidence proves that there's a high correlation between online infidelity and the real-time sexual affairs. But what do you think the tendency of men and women to cheat in a sexual relationship? So you can comment down and tell me what do you think could be the possible causes why men or women cheat in relationship. Now I'll be sharing with you why women and men see infidelity or cheating so differently. All right. So according to Robert, is a doctor clinical psychologist, he presented data. He presented a qualitative research that show men and women in cheating. For many men, sex is sex, and relationships are relationships, and the two do not necessarily overlap. Thus, a man who casually cheats may do so without feeling a significant degree or emotional connection to a mistress. while a woman who cheats could see things differently, with sex and emotional connection intermingled in ways that make compartmentalization more difficult. So here, as you can see, that men will actually cheat because of sex, but not an emotional connection. However, for women, they tend to cheat because there is emotional connection. Okay? Stated another way, when women cheat, there's usually an element of romance, intimacy, connection, or love. That's why most women love watching a storyline in 50 Shades of Grey, 360 degrees, so Maximo. So they don't just see that kind of sex as an object, but they want to see that as a storyline. What's the story behind that before they experience that? Men, on the other hand, are more likely to cheat to satisfy their sexual urges with fewer thoughts of intimacy. Of course, many men cheat because they feel love as well as sexual attraction for an outside partner, but many more don't. Many more don't. So see, male sexual desire tends to be driven by physiological rather than psychological factors. So this is why the porn sites created for male users feature short scenarios, focus on the body parts and overt sexual acts, and little less. Even the porn literature for men tend to focus more on sexual act rather than relationships and feelings. But not so for women. So they open up for romance novel, tune into True Blood, the Twilight movies, or other female-oriented romance erotica. This is true even more overtly sexual 50 Shades of Grey series, in which really bad boy meets a really nice girl who knows in her heart that she can find the good in him and make the relationship work. Alright, so you see, actually, it is both men and women have the tendency to cheat, but in a different way. So men would actually cheat for to satisfy the sexual urges, and that is due to their physiological reaction rather than their psychological. But women, on the other hand, is opposite. No, the reason why they cheat because of the emotional connection on it. Next, we will talk about the physiology of human sexual response. So, what are the stages during sexual activity? So, let's begin with number one. It's what we call the excitement phase or stage. So this happens when the two of you meet together. There is a physiological reaction with the blood pressure, increase of blood supply to the surface of the body. That's why you feel you or what is we call the you tend to redden or what they call you tend to become you blush or even the reaction of your body, and then the swelling of the distensible body parts, so your vagina will actually swell or even your nipple will actually harden and so on. the there is a rapid breathing and the secretion of genital fluids, the pre-calming, expansion of the female reproductive organ, increase in muscle tension. These symptoms arousal eventually increase to a near maximal physiological level. So the excitement stage. Okay, next is what we call the second stage, is what we call the plateau phase. So this is generally of the brief duration. So brief lang duration. This is now the sexual climax usually occurs. So this is where the sudden intense pleasure, an abrupt increase in pulse rate and blood pressure. So there's now the emission of the semen, and there's what they call the involuntary vocalization. That's why when men or women will actually, experience in this time, so there is what they call the vocalization. So they tend to really moan, in pleasure. So sexual climax lasts for a few seconds. And the resolution phase, so this is where you're almost done. So this the physiological reaction becomes normal, and male and females are the same in their response sequence. However, male return to normal even if stimulation continues. But for a female, so the stimulation can still produce additional sexual climax females. So we will have part two of this lesson because we will next time we'll talk uh, about sexually transmitted diseases and what are the methods to prevent those things that will end our series. So for this time, we'll have this lecture is our part one. So if you have questions, so please comment down and give me your reaction about this video. Right? So thank you so much and see you in my part two of this of the series 1. Thank you so much and God bless